The British Journal of Primary Care Nursing is a fantastic resource for nurses who are trying to keep up to date. You can have it online, so you can have it on your tablet, you can have it on your phone, you can have it on your laptop, you can access it whenever you want to. But the most important thing about it is that it is so real. So it's a really good way of keeping up to date with stuff that matters. If you're working in the area of cardiovascular disease, lifestyle interventions, diabetes, prevention or management, then the BJPCN has got something for you. So you've got everything from your really quite important new studies that are coming out where you get the top line information that you need, and then you get the articles written by people in practice saying this is what I do and this is what might work for you. You've got information for patients to actually help you to explain things to patients. You've got the craft cards, you've got the nurse education network associated with it. Continuing professional development modules that people can access with self-assessment to make sure that you are actually keeping up to date. There are lots of different ways that will appeal to different learners with different learning needs, and I think that's where it really does give you the answer to most of the challenges that you might have in terms of those areas. So it's really important to think about signing up for the British Journal of Primary Care Nursing because it gives you all of the key information that you need. I think it's really incredible in this day and age to have a resource that is so fabulous that actually is free to access. What more can you say?